Thank you guys for sticking with us. And I am so honored and privileged to have Sarah join us today. She embodies resilience, strength, and forward momentum. Her journey with NF1 began almost immediately after birth when she underwent multiple surgeries in her first week of life to remove tumors from her mouth. From the very beginning, she faced challenges that would have overwhelmed most: chronic pain, neurologic complications related to her neurofibromas, and numerous surgeries and medical treatments over the years. And yet, her story is not defined by hardship. It's defined by perseverance and purpose. Sarah raised 3 wonderful children, built a full and meaningful life, and has become a passionate advocate for NF1 awareness and research. She continues to use her voice to push for better treatments, increased funding, and real progress for individuals and families affected by NF1. Today, Sarah stands in a place of hope. She's here to share her story as a testament to what's possible when patients have access to the right care, innovative therapies, and strong support systems. Her journey reminds us that with the right resources and community, the trajectory of life with NF1 can truly change. So thank you so much for being here. We are so beyond blessed to have you, and thank you for letting us share your story. We just have a few questions to kind of highlight where you've been and where we're moving towards. So just briefly, can you share with us about your journey and treatment and how you're feeling today?
Yeah, so as you shared, I was born with the 6 tumors coming out of my mouth, and they were about the size of an orange. So it was immediately apparent that I had NF because I have 2 family members that have NF. I have been saying neurofibromatosis for as long as I can remember, and even explaining to people what cafe au lait spots are and what NF is. So this has just always been a part of my life. As an adult, I have more peripheral nerve sheath tumors, neurofibromas, than you can count. And these cause a lot of pain. I have chronic migraines, so it can be a lot to carry. And I've been really grateful to have an amazing care team that really cares about me, that really tries to work with me to help me find the solutions that could work for me. If it's surgery, then it's surgery. If it's a medication, then it's a medication. So this has been really, 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 really very helpful to me. But I've also found that the community, the friendship, people that I can laugh with and who understand what I'm going through is as helpful as the medical treatment.
Yeah,
right.
Absolutely. And I know that we briefly talked about, you said surgical options have been a part of your treatment, medical options have. How do you feel about the use of MEK inhibitors and their role in improving quality of life?
I am so thankful for MEK inhibitors. Mm-hmm. We have 2 MEK inhibitors that are on the market specifically for NF. And that has been such a change. When I was born, there were no treatments available for NF at all. It was very little understanding. And now, it's just in the last 5 years, have 2 options. I'm currently on a MEK inhibitor, and I have been for a year. I think that finding the right MEK inhibitor, the one that has those symptoms, the toxicities that you can tolerate, can be a process, and that's the trick. But I'm so glad that they exist and that I can use one.
Absolutely. And I know you briefly touched upon, finding the one that makes the toxicity and the side effect profile the most tolerable or bearable. So could you potentially give your perspective on the side effects, how they impact your life and how you've been managing them, and if they're manageable or tolerable, where the benefit outweighs some of the side effects that can potentially be at risk for?
Yeah, so some of the side effects can be that rash, and finding the balance of, how can we counteract that rash? What skin treatments or other, maybe an antibiotic that might work for a specific patient. Mm-hmm. Lifestyle modifications.
Yeah, certainly. And do you find that counseled on upfront with some of those side effects is helpful for you in determining whether a MEK inhibitor was helpful for you? Did you feel like you were able to kind of discover some of these management strategies with your care team? Were these things that you discovered on your own? Like, kind of walk through that process and how you found something that's most beneficial to stay on this therapy and make it worthwhile to be on it chronically, because a lot of these you do stay on for at least a couple years, right, or as long as tolerated.
Yeah, so I think it takes a whole team.
Absolutely.
It takes a whole team of individuals and doctors and care providers helping you to manage those specific symptoms. For me, it was finding the right MEK inhibitor. Mm-hmm. It was finding the one that my body could tolerate it. Mm-hmm. And all the different scans that you have to do to go through to make sure that you aren't having a dangerous toxicity. It definitely important to go into choosing to go on a MEK inhibitor, understanding what the possibilities could be.
Absolutely. And I know that a lot of times in the pediatric world, I'm sure in the adult world as well, there's multiple specialties that we involve when starting a MEK inhibitor, for instance, dermatology counterparts, and, sometimes in cases, GI specialists and things like that, that kind of help to manage some of the cutaneous or skin toxicities. Is that something you found beneficial, is following with, like we said, it takes a whole team.
Yes.
But how often do you check in, I guess, with those specialty members, and are they kind of helpful in steering if one thing's not working? How do you kind of adapt and move forward?
Yes, I think the most beneficial care provider has been my dermatologist for the MEK inhibitor. I think yes. So so I was able to start another medication kind of alongside of the MEK inhibitor right away, and that actually counteracted that major skin impact pretty well.
Good.
And so while I do have to manage it and keep managing it, I've been able to keep it under control.
Perfect. That's really great to hear. And to kind of shift, the tune a little bit, given your vast experience with your NF journey and medication management and surgical management, I guess it's put you in a really, really great position to advocate for fellow patients in this community. And so with your role in NF advocacy, do you feel the future is promising in terms of funding, public awareness? Kind of give your experience on that.
Yeah. So the advocacy is the fun part. NF is really challenging to live with. It's, you go through life learning how to hide your pain. You hide it from yourself even. And it can be very disrobing. You are often sitting in offices waiting to be in the MRI machine, and you're wearing the hospital gown and you feel very small. With advocacy is where I feel strong. And additionally, for me, ethos I live by is to love my neighbor. And so advocacy is this opportunity where I can love a really special neighborhood. And this has looked like a lot of different things. It's looked like being the walk director for a Shine a Light walk in our area, the first one last year, and we'll have another one this September. And that's an opportunity to meet families and to talk to maybe new parents who are new to this diagnosis, they're new to this world, and they feel really alone. It's able to say, hey, look, I'm an adult, and I'm glad I exist, and I'm glad your child exists. It's last week I was in Washington, D.C. on Capitol Hill in the offices of our congressmen and our senators, asking them to provide funding for NF research so that awesome doctors like those in the Cleveland Clinic and elsewhere can continue doing research to help find the solutions. It's even why we have MEK inhibitors, is because of this funding. And so making sure that that funding can continue to happen is so important to me and to my neighborhood.
Absolutely.
There's a lot of different ways that I'm able to advocate and connect with the community, because I have really found that finding those friends and neighbors that really understand me and whose stories I understand makes a difference in how I can handle what I'm dealing with. And there's a word that I really love, and the word is sonder. And sonder is the realization that everyone you meet has a story as rich and complex as your own.
Oh, I love that.
And this empathy, when we understand other people have a big story and we have a big story, and when we take all of our stories and we share them, it makes us feel less alone, and it makes our friends feel less alone. And when our voices get louder like that, people hear it, NF becomes less visible, and that's how change happens.
Yeah. And what advice, you've been part of the NF community since, like you said, infancy. So you've been throughout the lifespan. If you are meeting a family who's just starting their journey in the neurofibromatosis community, where do you encourage them to start? Like for somebody who's looking to establish with those neighbors and kind of have that community behind them, I know you mentioned Shine the Light Walk. Are there any other community resources that you found in Cleveland or Ohio that can kind of help them start and get plugged in so that they can also be in that advocacy or community role?
Yeah. Well, social media is a good place to start with a caution. I think a lot of times the voices we hear on social media are the scariest stories. And I think that a new parent with a new diagnosis, you don't always want to go down that rabbit hole. So I think some of the patient organizations, the Children's Tumor Foundation is an amazing one. the NF network, the Neurofibromatosis network, and NF Northeast, which is a little bit more northeast of us, but they really are an amazing opportunity to get connected with mentors, with people who are going through a similar journey to your own. But all those patient organizations, they have such good materials. There's an organization called the NF Collective that has classroom materials, so that if you want your child's classroom to have some information, so that maybe their co-students understand what's happening, those are provided there. There's information about how to get connected to a clinic, of which Cleveland Clinic is one of those amazing clinics to be connected with. But finding people who really have some level of education on NF, who aren't going to be making you afraid, but making you informed, and then providing that friendship.
Absolutely. And empowerment.
Yes.
Yeah, absolutely. And so, we hear that a lot from families where they start on social media, because when we are at Cleveland Clinic, where the resources are endless, that's awesome. But to have these patients that are kind of located in more isolated areas, it's difficult. So for those patients that are kind of looking to get their foot in the door, is there anything that you can recommend as community members, as allies, as advocates, to be able to kind of plug in early, who might not be as connected to close to Cleveland where they can attend the events and things? Is there anything from an advocacy perspective, policy perspective, that they can be doing on the day-to-day to kind of help advance the neurofibromatosis world and community and funding?
Well, right now, today is actually Rare Disease Day, which is pretty special. So if you go to any of those websites or any of the social media pages, you will find information about even how you can write a letter to your congressman. NF Network right now has that form out where you make it very easy to fill it in, put a little blurb of your own story, and that will share directly to your congressman to say, this funding is important to us. And I would strongly encourage everyone listening to do that, as soon as you can. Attend a walk, whether it be a Shine a Light walk in your region or one of the other advocacy groups. They often have walks or patient meetings. There are even remote coffee chats you can get connected with. Talk to people, make friends, hear other people's stories, and know that there are adults and children who have NF who are living and thriving. They're having a happy life. It's not a death sentence. It's not gloom and doom. We can kind of take the hard that's happening to us and accept it, find the right treatments, and then decide to live joyfully and in a way that brings life to yourself and others.
Absolutely. And as providers, how can we better serve patients with neurofibromatosis to make that joy part feel more seen, to be more to be in a role of advocacy, to empower our patients? Like you said, it's very disrobing to be in doctors' offices and imaging and things like that. So how can we as the medical team help to support our patients?
Yeah. So understand that people with NF, we become very skilled at hiding pain very well. And so we're not going to present the same as someone who is experiencing acute pain that they're not used to. To understand that we want consistency across the board, a shared language. When one radiologist reads our scans, we want it to have a similar language when a different radiologist reads the scans. We really want to trust the process. We want to trust that the care that we're getting is specific for the disorder that we have. That, again, those radiologists, that they know that this is an NF body. If we're getting a mammogram, that they're accounting for that large increase in risk. That it's not just, this is par for the course because you have NF. We want doctors who don't know about NF to be willing to educate themselves when we come in the room so that they can take care of our bodies.
Absolutely. And we have a couple minutes left. We talked a lot about the community. Is there any advice that you would like to give to those in the NF community today? I know that we spoke a lot about it, but parting words to other people who are diagnosed with neurofibromatosis or starting to navigate their journey. What final advice would you like to give to a patient?
Find a good doctor who listens and who cares about you. Find the friends who will also share your story and support you, but not scare you. Find a way to enjoy life and find a purpose. Take care of yourself. Don't go down the rabbit hole of looking at the extremes.
I think that's wonderful. Thank you so much. Again, we cannot put into words how lucky we were to have you today
Thank
and
you
be
so
able to
much.
speak on so many different regards of neurofibromatosis and your journey. So thank you for being here. We
Thank you.
appreciate you.
Well, that was really terrific. Thank you so much, Sarah and Allison. So, Sarah, thank you so much for sharing your story with us. That was a lot of great advice in there, very inspirational. I've kind of gotten to know Sarah over the past year. She set up that Shine a Light Walk, which is a tremendous success, and yeah, we're going to have another. She's going to set up another one in September. So really inspirational. And Allison Fisher, who is asking her the questions, I didn't introduce her, but she's one of the nurse practitioners in pediatric hematology and oncology. So she's a key member of our neurofibromatosis program. And so a lot of our families know and meet her. And she's well involved in the care of our neurofibromatosis patients.